Hey everyone, thanks for checking out my YouTube channel. In this video, I'm going to go over 4 simple tips you can do if you're suffering from supraspinatus, tendonitis, or tendinopathy on the outside of the shoulder. The supraspinatus is one of the 4 rotator cuff muscles that's responsible for stability and mobility of the shoulder. It runs right across the top here and attaches on the outside of the ball, the humeral head. So that's going to be right underneath the trap muscle here, kind of traveling over and attached on the outside of the shoulder. You may notice pain when trying to raise the arm out to the side, reaching forwards, putting your hand behind your head. So a lot of times if you go through some simple stretches, range of motion techniques, and a loading strategy or strengthening exercise, this can reduce your pain and return back to function of your upper extremity. Our first movement that we want to do is going to be a tabletop slide. I'm a huge fan of this technique. I think it's really simple. It's a lot easier for patients that are having a lot of pain than to raise their arms or go up and down the wall. You're going to take a pillowcase or you can use a blanket, and we're going to go out here as far as I can forwards and then come back, reaching as far as I can. Really lean into that and reach and come back. Now the supraspinatus muscles function with, as far as movement, it's going to assist more in bringing the arm out to the side or a little more, towards the front a little bit, not necessarily straight in the front, although it does have some contribution there. However, we're still going to go into that flexion type plane or elevation, and this would be similar if you were standing up as reaching up overhead. Repeat that for around 10 to 15 repetitions several times a day. This is going to be a stretch. This is a simple technique you can do either in the seated position or in the standing position. A lot of times people, kind of try to bring the arm across. I'm not against that stretch, but with the supraspinatus here, pulling that across may irritate the tendon as it passes under the subacromial space here. Not always, but it could. I just like this stretch better. What you're going to do is take a hold of the bottom of a chair and you're just going to lean away. I'm just leaning. I'm using my fingers and hand just to kind of hook the bottom of the chair, keeping my elbows straight. I'm leaning away and I feel that stretch down deep in the shoulder joint. I'm going to hold that for around 15 to 30 seconds and then relax and go back in again, 15 to 30 seconds and relax. And that's something I repeat for maybe 10 to 15 repetitions several times a day. So with our stretch and with our tabletop slide mobility exercise, those are 2 that you can do just throughout the day in most cases. Kind of more is better, to some extent. You want to be careful if that tabletop slide at the end ranges of motion really irritates the shoulder joint, maybe back off. Don't go as far. And again, just kind of repeat that, both of those several times a day. This exercise is going to be known as shoulder blade pinches or a scapular retraction exercise. So what you're going to do is kind of keep your elbows by your side, squeeze your shoulder blades together, almost like you're trying to pinch your spine in the center. You're going to hold that for around 2 to 5 seconds and relax. Go back again, really squeezing your shoulder blades together, pinching the spine together. And you're going to hold that again for around 2 seconds or so, maybe even up to 5 seconds. Repeat that for 10 to 15 repetitions. And that's an exercise that you complete around 3 times a day. Lastly, we need to perform a loading strategy. We know that loading tendons or putting them under a load during exercise can have an enhanced ability to promote healing. And this exercise, we're going to work on shoulder abduction. This is going to be an isometric. So there's going to be a muscle contraction with no joint movements. You're just going to contract the muscles. I usually have patients start out about 25% of effort. Hold that for around 2 to 5 seconds. Relax. Repeat that for around 10 to 15 repetitions. And this exercise is going to be something you're going to perform 3 times a day, just like the previous scapular squeeze exercise. So what you're going to do is go into the doorway here. I have the back of my hand against the doorway. And an old friend of mine actually gave me this name. I used to just call this just an isometric shoulder abduction. But this person actually called these doorway pushes. So I like that, doorway pushes. So we're going to push out. So I'm pushing out against the door frame here. And I'm going to hold that and then relax. I'm going to push out again, hold that and relax. So if the door frame was not there, I would bring my arm out to the side. So I would just go out to the side like this. I'm just going to push against it and relax. And you're going to progressively work towards increasing how hard that you're pushing against the door frame, working up towards maybe 75% of maximal effort. And again, that's one that you're going to perform 3 times a day. Thanks so much for watching this video. I hope that it helps with your supraspinatus tendonitis. Be sure and hit that subscribe button so you stay up to date on all my content.